Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. This paper was published in The Lancet. This podcast is on the transcatheter aortic valve implantation, TAVI, and FFR-guided PCI versus surgical aortic valve replacement and CABG in severe aortic stenosis with complex CAD. It was an international, multicenter, prospective, open-label, non-inferiority, randomized controlled trial. The participants included 172 patients aged 70 years and above with severe aortic stenosis and complex coronary artery disease. The treatment groups included TAVI plus FFR-guided PCI, 91 patients, surgical aortic valve replacement plus CABG in 81 patients. The primary endpoint was a composite of all-cause mortality, myocardial infarction, disabling stroke, revascularization, valve reintervention, and life-threatening bleeding at the end of 1 year. What were the key findings at the end of 1 year? The primary endpoint, in the TAVI plus PCI group, was 4%, that is 4 out of 91 patients. In the surgical aortic valve replacement and CABG group, it was 23%, 17 out of 77 patients. Met the non-inferiority margin with a p-value less than 0.001 and also showed superiority, hazard ratio 0.17, p-value less than 0.001. Mortality, TAVI plus PCI 0%. In the surgical group, SAVR plus CABG 10%, p-value 0.0025. Life-threatening bleeding, in the TAVI plus PCI group it was only 2%, while the surgical group SAVR plus CABG was 12%, p equals 0.010. Clinical implications and conclusion. This is the first trial comparing percutaneous versus surgical treatment in severe aortic stenosis with complex CAD. TAVI plus PCI reduced mortality and bleeding risk versus SAVR plus CABG. Favors a less invasive approach in selected patients. Limitations and future directions. Small sample size. Larger trials are needed for validation. It was limited to a single TAVI device, Medtronic Evolute. Longer follow-up required for durability assessment. Conclusion: TAVI and PCI is a viable alternative to surgical aortic valve replacement plus CABG with better safety and mortality outcomes.